Hello, welcome back again. This is Prudence with Prudenois Health. Today we are just continuing our topic on the pituitary gland, which is the master gland. Today we're going to be addressing hyperthyroidism. That is when the pituitary gland is like on overdrive. We have like excess thyroid hormone in circulation. Signs and symptoms of this will be like increased sweating, irritability, there's anxiety, there's like fine tremors, there's like mentation changes as well. People like eat a lot, they report eating a lot, but yet they're losing weight. They also have symptoms like tachycardia is like the big thing, the red flag. It often throws people into atrial fibrillation. So it's one of those conditions that we really need to go get it checked and get treated, because people with especially if you go into AFib, then it's like you have to be on like blood thinners, like, hey, henceforth, that's going to be like your plan of care. So it's one of those conditions that you have to really like catch it quick and go, don't sit on it, go get it treated. We are going to look at this little table. It's like a picture, a diagram that kind of shows us again the signs and symptoms of hyperthyroidism. I'm sorry, my picture is kind of like dancing all over the place. We have, again, there's like the weight loss that I talked about, the heart, the heart arrhythmias is like the big red flag for most of the people with the condition. There's also like muscle cramps reported with some patients. There's an enlarged thyroid with some people with hyperthyroidism and the goiter. In terms of causes of hyperthyroidism as well as hypothyroidism, there's an autoimmune factor to it. So it's just like something that the body does, like in defect, the body just attacks itself with both conditions. Treatment varies. With hypothyroidism, there are the pills that they use to treat. With hyperthyroidism, there's pills, there's like radioactive iodine, there's like a thyroid ablation, there's sometimes they take out the whole thyroid gland. So it's it's like a condition that you cannot really like, hey, I'm just gonna watch and wait and see what happens. You really need to get it checked, especially if you go into AFib, right? AFib is not something that we want. Atrial fibrillation is not fun. It's really not fun. Again, a big telltale sign for some people with hyperthyroidism is the Graves' disease. They have like their eyeballs are literally like bulging out of their heads, right? If you have anybody, if you know anybody that it looks like with any of these things, that's like a family member, you have to like just advise them that, hey, to go get it checked. Again, my goal for doing these videos is just to give information to people that are not necessarily privy, like have this information ready at hand. I come from a place where I was in big lack of knowledge, and I know there's a lot of people that don't know some of these things. And from my culture, I know that we don't like to go get checked out. Like we just watch and wait and see what happens. Hopefully it goes away. And sometimes it does, sometimes it doesn't. We're realizing that people younger and younger now are getting sicker, and there are things that could have been avoided, things that could have been prevented. My goal is just to educate and also maybe help someone to know that, hey, it's okay to go get checked at least once a year to make sure that everything is running well under the hood. Again, it's Prudence with Prudenois Health. If you have any questions, please ask. Don't forget to comment, leave your comment, like and subscribe, turn on your notification bells. That way you're notified whenever I drop some new content. Again, as always, thank you so much for watching.